Yeah, thank you. Thank you. It's a real pleasure to be here today. And I guess my talk is talking about when your professional work, you know, I've been a social worker all my life, social work academic, and when that collides with life experience. So, as Danny mentioned, I do currently work for the Open University as a regional academic, and I've been really lucky to, as part of my role at the Open University, to really get engaged in research and scholarly activities around my interest in organ donation. But my real interest in organ donation is very much based on my lived experience. So in 2016, my daughter, Fiona Braidwood, died suddenly and unexpectedly in a car accident. She was aged 17. And she was in the very rare position, only 1% of the population die in a position where they can become organ donors. As a society, we can find it uncomfortable to hear the voices of bereaved parents, and these voices often remain hidden and with limited opportunities for us to learn directly from families and learn from their experiences. So in this presentation, I'll share my experience of organ donation and share how much it was helped by knowing what Fee wanted to happen if she was ever in that position where she could provide a life-saving organ. And I'll also talk about the legacy. We've talked about Claire's model, and this focus of my presentation is very much on the legacy. I recognise that my experiences might be hard to hear and might be triggering for individuals. So please step away, seek support if you need it. There's masses of people out there who are really good at supporting bereavement support. But I hope rather than sadness, my presentation brings a recognition of the personal growth that can come out of difficult circumstances, and that it is possible to survive and thrive when a much-loved child dies. And I believe Fee would love it that I was sharing her story today at this conference. She came to Norwich often. Her aunt and uncle lived here, and it was a city that she really loved. So it's a real pleasure to be in Norwich today. Before sharing my story about Fee consenting to organ donation, I wanted to provide a UK organ donation and transplant context. And the law has changed since Fee died in 2016 in all parts of the UK. We're now in an opt-out system. There are currently over 8,000 people on the UK transplant waiting lists, and that is the highest number that there's ever been. And people die every day waiting for life-saving transplants. And in May, on the 20th of May, which coincides with Fee's birthday, will be the 5th anniversary of when the opt-out law changed in England. And it's a law that some people here might know in terms of the name of the Max and Kira's law, which was the law inspired by two 9-year-old children, Max, who received a heart, and Kira, who donated her heart. But it's important, so the legislation now assumes, unless an opt-out has been registered by the individual, that you are consenting to organ donation. But it's important to emphasise that surrounding the UK organ donation law, a soft opt-out exists. So family members continue to be consulted and asked to confirm the deceased person's last known wishes. So the people closest to you will be approached by specially trained medical staff if you die in those circumstances where you could provide a life-saving organ and you haven't recorded an opt-out decision. So families really do remain at the centre of the decision-making. But it's also really important to say that these conversations aren't taking place at a normal time. They're taking place at a time of trauma, of unexpected death, and people, it isn't a good time to be thinking about that for the very first time. And it's even more important under the new legislation to have those conversations with those people who might be approached by the specialist teams. And so that those people know and can, with certainty, confirm your known or last wishes around each and every organ or tissues that you want to donate. And I'm part of a donor family advisory group with the NHSBT, and I was on a call last week where they shared some really worrying trends in terms of the number of families in the last year who, for whatever reason, haven't felt able to consent to organ donation. There were 170 families approached and asked to confirm consent to organ donation. 140 of those people were had opted in to the organ donor register, and those 170 missed opportunities happened because families weren't able to make those decisions. So it's really important, and I've been at the stall with Debbie today, and it's been great speaking to people about, have they joined the register, have they made their choices known? And I think, the most important thing is that you do it loudly. You do let people know what your advanced care wishes are in relation to organ donation. So it's not enough to just register your wishes. And if the ambitions of the opt-out law, those 2 9-year-old young people who put their name to that legislation, we really do need to sort of encourage those conversations in life. And I know the whole theme of today is let's talk about these things that we feel uncomfortable about. So my presentation, I'm going to, I imagine you all think, gosh, this will never happen to us. We'll never be in that position. So it's something that I don't need to think about. But, I'm going to be sharing to you, I was in that position and what helped and what made that easier. So I am going to sort of use an academic theory to sort of share my narrative, to share my lived experience. And it's a model that has been shown to be effective when working with donor families and supporting them to share their lived experience. And it has sort of 6 features, really. And so that narrative, I'm going to be introducing you to Fee. I'm going to tell you about what happened, the car accident that she was in, the medical care that she received at the hospital, and the approach about organ donation. And then, of course, what happens afterwards, how we've adjusted and made those changes. And, of course, with all academic modules, you need to tweak them and make them relevant to your own case example. So I love starting presentations and introducing people to Fee. She was amazing. She was beautiful, clever, healthy, strong, talented in so many ways. She would light up the room. She sparkled with energy, and my goodness, she lived life to the full and was so excited about the future. This photo was taken on her first day at sixth form. She had done so well in her GCSEs, all at A and A-star level, and she was going to make a difference. She was going to go to university, and after university, she wanted to be involved in government policy. She was going to sort the world out and make the world a better place for us all to live. And so in sharing about Fee, it also feels important to just tell you a little bit more about her character, her qualities, and those principles. Like a lot of young people, she stood up for things that she believed in, and organ donation was something that she felt very strongly about. She'd had a talk at school, and that had inspired her to come home. And did you know, Mum, that people, when you die, and you can do this, and it's really important that you register and you talk about it, and I'm telling you, this is what I'd like to happen if anything happened to me. Fee was a keen user of social media, and she followed the causes that she felt were important. And I think this slide shows some of the things. These were taken directly from her bedroom wall, and I think she had these little sort of messages around that sort of helped her to think about the things that, you know, how she lived her life. And it's really important to stand up for things that you believe in, even if your voice shakes, and that as all individuals we can make a difference, and we shouldn't be leaving it to others. And Fee wanted to write, wanted her life to matter and to live a world worth writing about. And it sometimes feels that Fee has handed over an important baton to her friends and family and the people that she continues to inspire and touch after her death. And Fee's inspiration was really important in, it's an important theme of this presentation, but also the legacy that she's left. So I guess what happened? The day started like any other, but the headlines are she was involved in a car accident very close to home, and she sustained a serious head injury. She was treated at the scene and then airlifted to the Regional Neuro Centre in Bristol, Southmead Hospital in Bristol. The assessment in A&E confirmed that it was devastating brain injuries and that it wasn't survivable. That information was shared with us immediately when we arrived at the hospital, but Fee was transferred to ICU in terms of checking in and, and that provided time and space for us to process what we were being told. So we spent a really precious day and night with Fee, watching her life slip away. So the next feature in the narrative model encourages a reflection on that in-hospital experience. And here I'll share what I valued and what helped us as a family on that truly dreadful day. I am so grateful whoever made that decision to airlift Fee to hospital. It meant we could spend time with her and we could spend time together as a family. The kindness and care shown to Fee and the family-centred care was so compassionate that we received at the hospital, and we really appreciated it. At all times, medical staff explained what they were doing and why, and importantly, involved us in her care. The environment at ICU felt calm and relaxed, and I know it's a very clinical environment, and I know there's people here who work in those environments, and I don't know quite how that calmness and that sense of tranquility is created. It must be the people who are working in those units. We had time, it wasn't a lot of time, that sort of 12 hours, but it didn't feel rushed, and it felt like we had time. It felt an endless time. And it was just wonderful to be with Fee and to be together as a family. We really valued the very simple, clear, and consistent messages that were shared with us by the doctors and nurses as she passed through the hospital. And this helped us to hear what was being said. Our understanding was regularly checked. And I think there was the term, what do you understand is happening now? You know, checking in how much we were still retaining what was being said. Fee was always kept at the centre of the care, and we witnessed and saw her receiving high-quality end-of-life care. And in between those medical updates, we were spending time with Fee at her bedside and observing and witnessing the reality of her injuries. We were told how poorly she was, how serious her head injury, and we were watching her deteriorate throughout the day. So for us, it didn't come as a surprise to know that Fee was dying and was receiving end-of-life care. I hope these examples provide the impact of high-quality care for families facing really difficult and traumatic experiences, and why it's valued at the time, But I think more importantly, afterwards, when the trauma is revisited as part of that sense-making process, the conversations we had on that day, the trauma, the shock, the emotion, will just never be forgotten. And it has been relived and revisited over the years. So, consenting to organ donation. My family's experience to consenting to organ donation was helped greatly by knowing Fee's end-of-life wishes. Fee had passed on her wishes so clearly, and we had certainty that it didn't feel like we were making a decision for her. We were honouring her decision. The discussions about organ donation weren't rushed and were introduced at a time that we could cope with and were ready. I think we were asked, were we aware that Fee had placed her name on the organ donor register? And we were guided through the process with sensitivity and compassion. The transplant process was explained, and it was explained that it might not be possible. For example, the coroner might not agree to it if Fee had continued, and if Fee continued to become unstable and needed treatment, and it would mean that her organs weren't going to be suitable for transplant. So a point during the day when I think I'd accepted that Fee was dying or had died, the chance of organ donation became a really important focus for us as a family. So saying yes to organ donation was, I can honestly say, the only easy thing that happened on that truly dreadful day. At all points, we felt in control of the decision-making. It felt like the specialist nurses and the medical professionals were guiding us through a process that they were familiar with. And it was reassuring knowing that there was expertise and professionalism. And as a multiple organ donor, Fee went on to save the lives of 4 people. And it's such an incredible legacy, something I'm immensely proud of and continue to be proud of. So 9 years on, we're still adjusting to a new way of living, and the sadness continues, but never ever with any regret around organ donation. So what happens to families like mine when you leave the hospital after such a traumatic death and having consented to organ donation? How do you adjust and find a new way of living? And does consenting to organ donation bring comfort or create complications and the complexity of the grief experienced? And the reality is that individuals and families are diverse with different needs and experiences, and so the real skill in providing aftercare bereavement support following organ donation is about being guided by the family, supporting them to make sense of what they've experienced when they feel ready, and providing support in finding what can bring comfort and with the life adjustments that they face. So, for us, it took time to find a new way of living with this massive loss. In looking forward, we knew that Fee's energy and spirit needed to remain present, and a momentum began to grow after Fee's funeral for something positive to come out of all the sadness as we started to actively grieve. And when I talk about active grief, I wanted just to explain what that means to me. This has been an acceptance of what's happened, a realisation that I can move forward with hope and joy, and that can sit alongside the sadness, and finding a focus that has felt meaningful and can bring comfort while not denying that the pain is still there, and also how to shape my grief experience. So there's been many things that have helped me to move forward with hope and learning to dance in the rain. But as part of this ACP conference, I'll focus on Fee's positive organ donation legacy. So the next few slides will just show some of the ways that I've made sense of the trauma and used the opportunities to celebrate Fee's gift of life at the end of her life. So one of the first things that happened in building Fee's organ donation legacy was her cousin made a short film sharing her organ donation story as part of a university project he was working on. The film helped to raise awareness of the importance of having conversations about organ donation as the opt-out legislation was being introduced in England. So Fee's cousin, Mikey, returned to the hospital and interviewed the staff that cared for Fee and helped to sort of digitally document our experiences on that day. And then other initiatives followed where we also had the chance to formally mark Fee's incredible gift of organ donation. And the next slide just shows some of the things that have, in terms of building her organ donation legacy. She has a wall plaque at Southmead Hospital that I previously mentioned. I've shared my story as part of NHS BT's Leave Them Certain public awareness campaign. I've become a member of North Bristol Trust's Organ Donation Committee. I'm a member of the Donor Families Advisory Group, which is a body within NHS BT. And I've been involved in talks and presentations, raising awareness of organ donation and the donor families' experience. And all these opportunities have helped me to become more confident in sharing our experiences of organ donations, and importantly, so others can learn. Also, as a social work academic, I've had the opportunity to develop a range of learning resources focused on sharing lived experience about organ donation. So I was really lucky to be a guest on Claire Fuller's podcast where I was interviewed and I shared my lived experience on her wonderful podcast. I've had the chance to write about my grief experiences as part of an edited book at the Open University. I've taken part in BBC Ideas films exploring some of the ethical dilemmas around kidney donation. And I was really lucky to work with other donor families and NHSBT staff in terms of developing an open learn resource which is freely available, sharing two other donor families' experiences and sharing their narratives, their stories. And I've recognised that there are different audiences that can benefit from hearing lived experience. So healthcare professionals, those people who are keen to continue to improve end-of-life experiences, like a lot of the people at this conference today. Also other families who are going through something comparable and are looking for resources developed by peers and to, as they're making sense of their own lived experience and to see what resonates with their own. But most importantly, creating opportunities for wider public awareness. Real life experiences can help individuals really think deeply about what their choices are, what they would want to happen at the end of their life. And, they're big questions, aren't they? And alongside the resources I've developed, there are amazing resources on the NHS BT website as well. And Debbie's here today with a stall and lots of information that, if you're interested in finding out more about those resources, I know Debbie would be a good point of contact. So I recognise that, the opportunities I've had in my professional capacity to develop these resources as part of my paid work, how lucky am I, have also helped me, have led to personal growth as well. I never thought I'd be talking at a conference like this, which is being live streamed. And certainly talking and writing about Fee doesn't make me feel sadder. So we are talking about legacy, and I couldn't resist the opportunity to also share another really important part of Fee's legacy was the setting up of Fee's Fund, which stands for Fee's Enrichment Education Support Fund. Fee loved learning and engaging with new ideas, and she was just really lucky to have the opportunity to take part in lots of extracurricular activities that really sort of nurtured her talents and got her involved in things that she felt were important. And so it felt really important that, as part of Fee's legacy, that we also did something around you know, lots of young people with the cost of living crisis are missing out on enrichment activities, the things that make learning fun. And so we actively fundraise and then give out grants to children who are living in families where money is tight, and you know, so that they can have fun, they can do the things that they want to. So yeah, if you're interested or you know young people that are missing out currently, please check out the Fees Fund website, and you know, it would be lovely to think there were grants applications coming in from people who had heard today's talk. So returning to Fee and her determination to live life fully, to be happy and to have impact has really helped to shape my grief experience and has been guiding in developing her legacy. I've tried to honour her wish to have a life worth writing about, and to speak the truth even if your voice shakes, and I know there's been a few times my voice has shaked. As mentioned in this introduction, as a society we can find it uncomfortable to hear the voices of bereaved parents, particularly when there's been a traumatic accident that's resulted in sudden death. And I've been inspired by the work of Denise Turner, who is a UK social work academic, but she's also a bereaved parent. And she identified the challenges of telling the untenable, and the way child bereavement is a taboo subject and considered dangerous knowledge. And her research is really inspiring, where again she worked with a group of bereaved parents and used a narrative approach and empowered those parents to tell the story, both as their stories as a collective and as individuals. And her research, I think, also has helped to demonstrate the triumph of meaning-making over tragedy and the humbling acceptance of death as part of life. And I've also been really inspired by the work of the Life, Death, Whatever WebSpice, the 5 Things approach. And I'm sure people here are familiar with the work of that organisation. People submit share their lived experience of illness, cancer, dying, funerals, grief, suicide, addiction, and so much more, and use the 5 themes to share what they've learned from that experience. So I'd just like to end by sharing my 5 things and the key learning that I've gained from my organ donation experience. So, Time has been a great healer, and it does take time and slow adjustments. And it's only when you look back that you can see that time actually has helped. So for me, memories and that continuing relationship, keeping Fee's energy and her memories close has been so important. I don't want her to ever be forgotten, and I'll continue to seek opportunities to talk about Fee and celebrate her many talents and her life achievements with others. Support from others. I've needed to develop an extensive support network that has worked for me, and I continue to draw on the support of friends and families and the communities that knew Fee and are missing her. So many people have reached out and provided us support. I think reflecting and keeping a regular journal has also helped me to gain a sense of control over my grief experiences. And it's been an amazing gift to oneself to read back and see how you have survived the most difficult times and have a record of that journey. And it's helped me feel strong and recognise that anything is possible. And the importance of kindness, those small acts of kindness, particularly following traumatic events. It has felt humbling, and I'll never forget the outpouring of love and support and the kindness after Fee died and after the years that have passed. They say it takes a whole community to raise a child. In my experience, the same is true to grieve the death of a child. So this slide is just returning to the wall plaque. It's one of several at Southmead Hospital. They surround a beautiful piece of commissioned artwork, bringing together the voices of transplant recipients and donor families, showing that unique bond that exists between donor and transplant recipients and the ripple effect of organ donation, how it touches people's lives. I hope I've helped to show that sharing stories based on difficult circumstances can be an important resource for learning. And thank you so much for listening and creating this opportunity for me to share about my daughter Fee and her incredible gift of organ donation and the legacy that it's left. I hope that it encourages people to have those conversations about organ donation, and as the theme of today, very much think about it in relation to the advanced care plans and what's important for you. But thank you, and I think I've just some contact details.
Thank you, Vicky, so much for that. Absolutely. Is there any questions? I've lost the mics. I don't know where Rupert's taken me mics from. So, but do we have any questions? They're here. Any questions from the front? Any questions at the back? None at the moment?
Nothing online.
Oh, sorry. I can't. Should have gone to Specsavers.
Thank you so much, Vicky. I wasn't actually going to ask you a question, but I was just going to add something about tissue donation. And is it okay? Do you want to say anything, or should I just say something? I was just because obviously organ donation is only possible if you die receiving advanced organ support, which is why it's such a small proportion of deaths. But tissue donation is much more possible. So there are you can donate tissues in almost any setting. So certainly people who die in hospital can very often donate tissues and help up to 50 people. And eyes can be donated even in community settings. So eyes can be retrieved even in a funeral director. That's for cornea. So I just wanted to add that on.
Yeah, really important. Thank you. And I think, you can, when you look at the organ donor register, you can consent to each and every organ. And certainly as a family, when we agreed to organ donation, we were asked to consent to all those donors. And I think my husband did those conversations, and it was like, I've just agreed to it all because I think that's what Fee would want. But so it's really important, isn't it? And that people who don't die in the circumstances where they can become an organ donor, because you need to be ventilated, you know, it's quite rare situations, but tissue donation, and particular the gift of sight, cornea transplant is so important. So, and that can be healing for those families at the end of life as well, so.
It was just that because people won't generally ask you outside the intensive care setting about tissue donation, so people who want to become tissue or eye donors, it's very important that you yourself in the dying process or your family members mention it, because you often won't be asked about it. So it's a bit different to organs because they will be quite proactively sought.
Yeah. And we, just so you know as well, in the advanced care plan, in the Norfolk and Norwich one, we do have that at the bottom because we recognise that many of the patients that maybe we're seeing who do have a health condition will not have the opportunity to be an organ donator, but they can still donate things like corneas, heart valves, and just for your information, ourselves and Jones Paget are one of the top performing eye banks in the UK. So well done, everybody, and do spread the word. So thank you very much. Any other questions before we move on? No. Thank you so much, Vicky. Massive round of applause. So should we get them up?